Now, to start with, any advice to any patient or member of the public about whether or not to have treatment or a vaccination, which is a prevention, is based on the risk of benefit and harm that might arise from it. And the discussion around young people, a lot of it has hinged around that particular issue, because one thing that's clear about COVID is that the harms are not equally distributed across the population. And it is fair to say, I think, that serious health issues are comparatively rare for healthy young people. The majority will have limited symptoms, thankfully. Serious illness is measured in a number per million. And by that, I mean hospitalization, serious illness, not just bedbound at home, for example, for a bit. And deaths are thankfully very rare. Now, there are some rare complications of natural infection. These PIMS, MISC, are kind of rare inflammatory conditions, not entirely unlike some conditions that happen with other virus infections. There's a couple of things that you can get with measles, very, very rarely. There's a lot of discussion about long COVID, and the lowest, possibly the most reliable estimate I've seen is that maybe 1 in 50 people will have quite serious symptoms persisting 3 months. And that's comparison with people who've got other infections. That's not just, there will be more people who will have symptoms, but the excess bit that's due to it being COVID is probably quite small. Now, when the recommendations were made in relation to vaccination of younger people, the Joint Committee on Vaccination and Immunisation, the kind of expert group, confined pretty much its assessment to the health impact on the individual young people. Whereas the CMO, in making the recommendation that we would offer vaccination, also looked at some of the broader kind of social issues, particularly as they impacted on young people, such as loss of education from being off sick, given that they've already lost an awful lot of educational opportunity, mental health impacts of being further off sick, and other problems. There are also some issues about, unvaccinated young people potentially being a transmission risk to their vulnerable people among their own age group or older age groups. And there are, for example, current vaccinations where we do vaccinate some people who themselves are at relatively low risk to try and reduce the risk to others. So, for example, the rubella vaccination and human papillomavirus in boys, they're not dramatically at risk from those conditions. It's to reduce the transmission in the community. Now, and it's worth recognising that children and young people do probably have a better and more prolonged immune response to infection than adults. All of this is actually comparatively good. We shouldn't be looking on this as a set of problems. Now, the current vaccines vary a little in their effectiveness, but not dramatically. And certainly, I don't think once you're getting to a full course of 3 shots, for example, that we're actually offering to older adults at the moment, the evidence is emerging from Israel and other places that have gone down this route a little ahead of us, is that it reduces infections and dramatically reduces severe infections, hospitalizations, and deaths if you get as far as having a booster. And there is a reduction in transmission, partly because there's a reduction in infections. So if vaccinated people don't get infected, they're not going to transmit. But if they do get infected, they probably transmit less as well, from the evidence that I've seen. And all of the serious health problems tend to be more prevalent with COVID infection than they are following vaccination. So we've got all these positives from vaccination. There had been, when I originally looked at producing these slides, relatively limited direct evidence on young people, but those trials are now starting to emerge and showing very good protection from the vaccine for young people as well as for the original adults in the very big studies last year. Now I'm putting this slide up because I want you to look a little at the bottom half, and this is to show that all of these potential problems that you get at the bottom, like strokes, myocardial infarctions, rare thrombotic events, they're actually all more common with natural SARS infection than they are with vaccination. So even where, for example, this cerebral venous sinus thrombosis, which was recognized as one of the side effects, rare side effects, then that condition is much more common with natural infection with COVID than it is with vaccination.